Hello students, I am VLN Swarupini, lecturer in biochemistry from Sri Venkateswara College of Arts and Sciences, which is affiliated to Adikavi Nannaya University, Rajahmundry. Now, I would like to discuss about third year biochemistry, fifth semester, fifth paper, that is physiology, clinical biochemistry and immunology paper. And from this paper, the topic is basal metabolic rate. This is in the unit 3. Okay, so here we'll see about BMR and also factors affecting BMR. BMR is a basal metabolic rate, or we can also call it as basal metabolism. Okay, if you see the definition, it is nothing but the minimum amount of energy required by the body to maintain life at complete physical and mental rest in the post-absorptive state. Here, post-absorptive state is 12 hours after the last meal. That means if you have taken breakfast, the time after 12 hours will come under post-absorptive state. Okay, so that means after taking food and completion of 12 hours, how our body will require energy, minimum amount of energy which is taken by our body to maintain our life. Okay, and also it may be noted that resting metabolic rate is in recent use for BMR, as we are discussing this BMR under rest, physical and mental rest in the post-absorptive state. So while this BMR is calculated while we are at physical and mental rest, we are not doing any work and we are not even putting any mental stress. So physically and mentally will be at rest in the post-absorptive state, and in that condition we'll calculate the minimum amount of energy required by our body. Okay, that means why our body will require huge amount of energy when we are doing work or when we are thinking. So when we are rest, we require very little amount of energy. So as we are calculating this basal metabolic rate during the rest of any individual, that's why we can also call this basal metabolic rate as resting metabolic rate. That means metabolic rate, here the amount of energy required for metabolic rate during rest time is being calculated. Okay, so under the basal conditions, although the body appears to be at total rest, several functions within the body continuously occur. Okay, even though we are at in rest state, even though we are in total rest, few functions of our body will continuously happens. Okay, and these including working of heart and other organs, conduction of nerve impulse, reabsorption by renal tubules, gastrointestinal motility, and ion transport across membranes through Na plus K plus group consumes about 50% of the basal energy. Okay, if you take this Na plus K plus transport systems, they take glucose, they utilize glucose for their concentration gradient transport. Okay, so these are the few functions which undergo in our body even though we are in complete rest. That means our heart will not start working, and few other organs like lungs, kidneys, they won't stop working. Okay, and even though our brain will not stop working, and reabsorption of components by renal tubules of our kidneys will also carries, and gastrointestinal motility, and also digestion process, and also ion transports across the membranes. These are the few works or the few important functions of our body that undergo during rest. Okay, and here the role of energy production under such basal conditions per unit time, like 1 hour, and per sequence meter of body surface is known as basal metabolic rate. So we can also explain this BMR as it is the role of energy production under basal conditions per unit time and per sequence meter of body surface. Okay, this can also be explained as basal metabolic rate. So now let's see factors influencing this BMR. Factors influencing BMR. Here many factors like age, sex, and also climatic conditions, surface area, racial variations, state of nutrition, barometric pressure, body temperature, habits and drugs intake, hormones, and all these will show they influence this BMR. Okay, so let's see all these characters, how these characters will influence BMR. Okay, here the first factor is age. Okay, so here if you take this BMR is very high in children when compared to grown up persons. Okay, so if you take BMR of a child and of a grown up man, children will show higher BMR than the adult person. Okay, and at age of 6 BMR will be 57 to 57.5 degrees centigrade, and at the age of 12 it will be 50.4 degrees centigrade. So that means by increase in the age this BMR will be decreased, and between 20 to 30 years it is around 40 degrees centigrade, and if a person is around 40 to 70 years of age, they will show this BMR level to 38.5 and 35.5 degrees centigrade. So this is how this BMR level will be decreased with the increase in the age of any individual. Okay, so here in other words with advancing age, that means with increase in the age, BMR gradually falls, that means BMR gradually decreases. Okay, and this is due to the fact that children possesses a greater surface area in production to their body weight. Okay, but this is not applicable to the newly born babies. Okay, not for the neonatals, for the children who are in growing stage. Okay, and for newly born babies it is very low, around 25 C per SGM per hour. Okay, and in premature infants it is still lower. Premature infant means babies or neonatals who are born in the early in the 7th and 8th months. We if we take BMR of such infants, it will be even lower than 25. Okay, so how this age will influence BMR? By increasing in the age, this BMR level will be decreased. Okay, children will have higher BMR value, and elder people will have lesser BMR value. Okay, so if a person reaches 70 years, he'll show 35.5 degrees centigrade BMR, and in the age of 6, that child will show 57.5 degrees centigrade of BMR. So this is how BMR value will vary by the influence of the age. And the next important factor is sex. That means men and women doesn't show similar BMR values. Based on the gender also, this particular BMR will change. Okay, so coming to men and women show lower BMR when compared to men. That means men have higher BMR when compared to women, and the BMR of females decline between the age of 5 to 17 more rapidly than those of males. Okay, so we all know this BMR level will decrease with the increase in the age. So particularly in women, the decrease of the BMR value will be around the ages of 5 to 17, and during this age in women BMR value will be decreased. That means their minimum energy required for the body at rest will be decreased. Okay, so next factor is surface area. Okay, surface area. So here BMR is related to body temperature. Okay, so this BMR is related to body temperature, and in our body temperature is related to surface area of the body. That means based on the surface area of the body only, heat loss will be dependent. Okay, that means by surface area of our body, if surface area is high, heat loss will be high. If surface area is low, heat loss will be low. So heat loss and surface area of the body are both proportional to each other, and we know this basal metabolic rate depends on the maintenance of body temperature. Okay, so and this body temperature maintenance is again dependent on the surface area. That means if body has high surface area, what will happen? There will be more heat loss and body temperature will be decreased. So this is how this BMR is related to body temperature and to the surface area. So here this heat loss is proportional to surface area, and as this particular BMR is dependent on body temperature, this BMR is proportional to the body surface. Okay, that means based on the body surface area of the body, this BMR will depend. If surface area is high, BMR will be high, and if surface area is low, BMR will be low. Okay, and the next one is climate. How this climate will influence BMR? This BMR is very high in colder climates. Okay, that means it will, as persons who are living in cold regions, they require higher temperatures inside their body to withstand those colder climates. So that's why BMR is high in any persons who are dwelling in the colder climates. Okay, and in people who are living in tropical climates, they have lower BMR when compared to this colder climate people. Okay, and the next one is racial variations. So not only climatic conditions, racial variations also influence the BMR level. Okay, to identify a relationship between racial variations or effect of races on BMR of different races was compared. Okay, so race means like different kinds of people. So by taking BMR values of different races, the following results were identified. Let's see them. A BMR in adult Chinese, it is equal to the lower limit of normals for Westerns. Okay, so adult Chinese and normal Westerners BMR was compared. So both are equal to each other. And BMR of Oriental females, Oriental means East Asia. Okay, East Asia female students living in USA is an average of 10%. Okay, and below the standard BMR for American women of the same age group. Okay, here BMR of USA, proper USA women, and also East Asia women who are living in USA was compared. Okay, so here propers, that means natives of USA and also migrants of East Asia female in USA were compared, and these Oriental females, they have shown around 10% below the BMR value of the American women. Okay, that means these Oriental women are showing very they are showing around 10% less than the USA women. Okay, so this is another comparison. And one more comparison is High values of BMR around 33% and above normal have been reported in Eskimos. Eskimos, these are the people who dwell in Alaska. Okay, so in Alaska, this Alaska is a American country in which most part of the year is under cold conditions. So these people will have high values of BMR around 33% above normal. Okay, so these people show high BMR values. Okay, and how nutrition will affect this BMR? How nutrition will affect BMR? This BMR will be low in malnutrition and starvation conditions. Okay, so if a person is having a malnutrition, and also if he is starving or if he is fasting, he'll have lower BMR value. Okay, and also patients who are having long lasting diseases, also these persons will also have lower BMR value, lower BMR value. Okay, so next parameter is barometric pressure. So here moderate reduction of atmospheric pressure. Moderate, that means little decrease in the atmospheric pressure does not affect the BMR, but fall of pressure to 1/2 on atmosphere as occurs in mountains climbing increases, but increasing pressure of the oxygen does not raise BMR. So small changes or moderate changes in the atmospheric pressure will not affect the BMR. Okay, but fall of this pressure to half of the atmospheric pressure will lead to change in the BMR. And here if you see mountain areas, if you take mountain climbers, they'll be from different area, and coming to that mountain area, their pressure will be very less. Then what will happen? Half of they cannot withstand the temperature, the weather, and their BMR value will also change. Okay, and to raise this BMR value, there is no other alternative. Okay, and even though if we give oxygen to that person, then also this BMR level will not raise. Okay, so this is how this barometric pressure will influence BMR by small and minute changes. There will be no change in the BMR, but if pressure decreases to larger extent, BMR also decreases. Okay, and next factor is body temperature. Of course, this is an important factor, and here the BMR increases by about 12% with the rise of temperature. Okay, so if temperature raised, what happens? BMR will also increase for 12%. Okay, and due to the fact that increased temperature stimulates the chemical process of the body and thereby increases the BMR. So why this BMR is increasing? If temperature rises, what will happen? At high temperatures, chemical reactions that are present in our body will be very rapid, and ultimately BMR will be influenced and BMR will be increased. Okay. And next factor is habits. Okay, so trained athletes and manual workers have a slightly higher BMR than persons leading a sedentary life. Okay, so persons who are athletes, trained athletes, that means who are into athletics, and also manual workers, that means people who are working very hardly, they'll have higher BMR rate. Okay, and people who are having a settled life, that means their body will not be will not have proper exercise, and they'll be around all the time, they'll be in a partial rest stage. So in that particular persons, this BMR will be low, and in trained athletes or sportsmen, they'll show higher BMR, and also people who are working hard, they'll also have higher BMR. And the next factor is drugs. Here drugs means it comes under any medications. Okay, not only narcotic drugs, here medications are considered as drugs here. Okay, so quite a number of drugs like caffeine, benzodiazepine, epinephrine, nicotine, alcohol, etc. will increase the BMR. On the other hand, revise is observed with most of the anesthetics. Okay, so here by taking few medications and few drugs, okay, BMR level will be increased, and also by use of anesthetics, BMR will be decreased. Okay, here anesthetics means nothing but drugs which are used to give anesthesia or to give temporary sleepiness. Okay, so when by using these anesthetic drugs, there will be decrease in the BMR. Okay, and the next factor is hormones. Okay, next factor is hormones. Here circulating levels of hormones secreted by thyroid, adrenal medulla and pituitary, anterior pituitary increase BMR. 1 mg of thyroxine increases BMR by about 1000 calories. So here by presence of hormones, by the presence of these hormones, particularly of thyroid gland hormones, adrenal medulla hormones and anterior pituitary hormones, BMR level will increase. Okay, and if you take an example with the presence of thyroxine, which is a thyroid hormone, will increase BMR by 1000 calories. Okay, 1000 calories. So this is the best example to show the relationship between BMR and hormones, and particularly here not all the hormones will affect the BMR level. Only few hormones like thyroid hormones, adrenal medulla hormones, anterior pituitary hormones will affect this BMR. Okay, and also if you see few examples here, during thyrotoxicosis, BMR level increases. Okay, so BMR level increases by 50 to 100% than the normal values, but remains unaltered since both O2 consumption and CO2 production increases proportionally in cases. Okay, so what happens here? Thyrotoxicosis is a condition which is related to thyroid. Okay, and in this thyrotoxicosis, BMR will increase to 50 to 100% than the normal condition, and this will not change by O2 consumption and CO2 production will increase proportionally. That means by O2 consumption this will not be changed, but by CO2 production it will be increased. This is the reason for the increase in the BOD level of during this thyrotoxicosis. So another condition, that is myxedema. Okay, myxedema, this BMR is diminished to 30% or even 45% below normal. That means BMR will be decreased around 30 to 45% from the normal level. Okay, and anterior pituitary through its thyroid stimulating hormone affects BMR. Growth hormone also causes about 20% rise in BMR. So here how this BMR will be influenced means anterior pituitary through thyroid stimulating hormone, it will affect the BMR, and also growth hormone which is released from anterior pituitary, it will raise in the 20% of the BMR. Also catecholamines increases BMR by about 20%. Okay, and also male sex organs cause 10% increase in the BMR. Okay, all these factors leads to increase in the BMR value. And the next factor is pregnancy. So this pregnancy also affects the BMR rise or decrease. Okay, so in the BMR of pregnant mother after 6 months of gestation, it will raise. Okay, so gestation means it is the time period between the zygote formation and the delivery of the fetus. This period is called as gestation period, and After 6 months of the gestation period of the pregnant mother, BMR will rise. Okay, not in the first 6 months, after the 6 months, that means in the last 3 months of the gestation period, this BMR level will rise. Okay, so it may be noted in pregnancy the BMR of the mother is the sum total of her own metabolism as in her pregnant state and combined with that of the fetus. Hence, pregnancy exerts no specific effect on BMR. Okay, so during the first 6 months, BMR is both fetus and mother's BMR is calculated collectively. That's why there is no effect on the BMR. And the other important factor is fever and disease conditions. How these fever and disease conditions will affect this BMR. So, this fever causes an increase in BMR. Obviously, during fever, what will happen? This patients will have higher body temperatures, okay, and also increases in the BMR value, and an elevation by more than 10% in BMR is obtained for every 1 degree centigrade rise in the body temperature. So here, as we all know, during fever what happens? Temperature of that particular person will be very high. So by increasing 1 degree centigrade of that particular patient, then 10% of the BMR will be raised. Raise in 1 degree centigrade of temperature will result in the raise in the 10% of the BMR value will be observed. Okay, so this is how fever will influence the BMR. Along with this fever, few diseases like leukemia, infections, and polycythemia, cardiac failure, hypertension will also increase BMR values. Okay, and in Addison's disease, this BMR is marginally very low. That means BMR level in Addison's disease will be low, and BMR in leukemias and few infections, polycythemia, cardiac failure, hypertension, BMR will be high. Okay, so this is how fever and few diseases and infections will influence the BMR value. And next one is factor is starvation. Next factor is starvation, and during the periods of starvation, that means during fasting period, okay, the energy intake has an inverse relation with BMR. A decrease up to 50% has been reported. During starvation, obviously BMR level will be decreased to 50%. Okay, and this may be an adaptation by the body. Okay, so during starvation what will happen? Energy intake has inverse relationship with the BMR. A decrease up to 50% has been reported during the starvation period. Okay, and along with the starvation, if you see environment, climate and environment, both the factors will influence this particular BMR. Okay, so cold climates will always show higher BMR level. Okay, and now let's see about the significance of BMR. Significance of BMR. This BMR is important to calculate the caloric requirement of an individual and to plan a proper diet. Okay, so by calculating BMR value during a rest condition, that means the energy required by the body, minimum energy required by the body during the rest condition, we can calculate the calorie requirements, and also we can plan a proper diet for that particular individual. Okay, determination of BMR is useful for the assessment of thyroid function. Here, determination of BMR is useful for the assessment of thyroid function. Thyroid function can also be detected using this BMR. Okay, why so? This thyroid hormones influence BMR. Okay, these thyroid hormones like T3 and T4, they will increase the BMR value. Okay, by BMR levels also we can calculate the thyroid function. And also hypothyroidism, in hypothyroidism BMR is lowered, around 40% of the BMR is decreased, whereas in hyperthyroidism 70% of the BMR will be increased. Okay, and starvation and certain disease conditions also influence BMR. Okay, so main function of BMR is to identify calorific requirements and to plan a proper diet, and also to determine thyroid function. This particular BMR is very helpful. Okay, so this is about BMR, and please listen to the class for 1 to 2 times, and if you have any doubts please contact me, and also keep the material provided for you with you while listening to the class, and please note the important points. Have a happy learning, and thank you. Always stay safe at home. Thank you, students.